Otoplasty overcorrection. When should I start seeing changes? 1 month post-op. I had an otoplasty 25 days ago. No cartilage was removed, and the doctor only used permanent stitches to shape the ears. The swelling and numbness are pretty much gone by now, but the top parts of the ears are still touching the head, while the other parts of the ears look great, and the overall shape of the ears is great. When should I start noticing my ears moving back to a natural position? Should I see some minimal movement after 2 months post-operation?
Thank you for your question. You submitted your question without a photo, so that does leave some limitation into the degree of which I can maybe share with you my interpretation. But you describe in your question that you had an otoplasty done 25 days ago, and you state that no cartilage was removed and that the doctor used permanent stitches to shape the ear. And you feel like the appearance looks good, but you are concerned that the top part of the ear is very close to the head, and you're asking about what to expect in terms of positioning as the days transpire. You said that numbness and swelling is essentially resolved. Well, I think that I can at least revisit probably for you a discussion that you probably had with your doctor about what the principles are of otoplasty, and it might help you understand what you're going through at this point. Now, the other thing that I think is important is to also really ask this question to your doctor. This is a very important thing because only your doctor knows what was done during surgery. Now, that being said, a little bit of background. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and otoplasty is a procedure we do with significant frequency as part of the many things that we do in our practice. And I'll just, again, as I said, discuss with you the guiding principles of how I approach this area. When people have prominent ears, we try to identify the anatomic basis and then address the anatomy appropriately. So we look at the ear in a way of dividing the upper, middle, and lower third of the ear. The upper third is referred to as the antihelical fold, or the condition would be a lack of development of the antihelical fold. The middle part is usually an area called the concha, the conchal cartilage, or the conchal bowl, and so it's referred to as a hypertrophic or enlarged conchal bowl. And then, of course, the lower part is the ear lobe. Now, when you said that no cartilage was removed, I can consider that meaning that either there was no issue with the middle third of the ear, because when the conchal bowl is large, it is my practice to actually remove some cartilage in order to reset the conchal bowl closer. Now, there are procedures called a setback procedure where sutures are used to push the middle part of the ear towards the skull a little bit without using stitches alone. And often that's also accompanied by removal of an aggressive amount of skin. It's not my personal style, and I think a lot of my colleagues who do otoplasty with some frequency would share this opinion that it is because of the nature of cartilage and the memory of cartilage. It is likely, at least in greater likelihood compared to removing the cartilage, that the cartilage can return closer to its preoperative position. But assuming that essentially if that wasn't done, if the middle third didn't need addressing, then you're dealing with the upper third where the antihelical fold was created. Now, that antihelical fold is typically created by something called Mustarde sutures. And what that means is that from behind the ear, you're going into that space, and the cartilage is kind of weakened so that it would bend easily. And then permanent stitches are placed to fold the ear in a way that results in a natural-looking antihelical fold. So I think that the question is whether or not there's a possible overcorrection if you're not comfortable with its position, or whether in the correction of the middle third of the ear was pushed back or overcorrected intentionally using that setback approach with sutures with the expectation that it would regress further away. So that is something that only your surgeon will be able to answer. As far as I'm concerned, when I see my patients after surgery, I tell them that there's an issue. There's always this ongoing process of healing where a certain amount of swelling and a certain amount of just adaptation to the new position of the ear. You know, when people have come to me for otoplasty and their ears were very, very prominent, they want the ears to be practically plastered to their skull because they disliked having such prominent ears. But I explained to them that there's certain standards in terms of the distance from the skull to the different areas of the ear so that it's within a normal range and that it is also as symmetric as is reasonably possible. It's very difficult to get 100% symmetry. So your perception of the top of the ear being too close may not be the same as your doctor, especially when you take a view from like behind the scalp or the back of the head or from the front and look at it in line with the middle and lower third of the ear. Again, the absence of a photo does limit how I can advise you. What I would suggest again is talk to your doctor, meet with your doctor, review the procedure that was done, and get a good understanding of what the process of healing is like. Essentially, surgical wound healing does take about a year for full, complete healing. It is not unusual to have a little bit of shifting and changes which are in millimeters over the course of the first, let's say, 3 months or so after surgery. But generally speaking, after a certain point, the ear can look pretty stable. Now again, this is cartilage, and cartilage can have memory, and sometimes the cartilage can go back a little bit to closer to its previous shape, even though intraoperatively things looked good, and that may require an enhancement or touch-up, as is often referred. So again, meet with your doctor and review these concerns, take some pictures, or have your doctor review your photos with you, and then investigate what will be the future moving forward, and what are your options should any enhancement be necessary. So I hope that was helpful. I wish you the best of luck, and thank you for your question.